basically these folds of cartilage that make up the bulk of the nose. The meatus is the passage that the air flows through, so it's basically an empty space. And their turbinates are very complicated, they're very tree-like. That's compared to a human nose, right? So ours is pretty boring and plain compared to what's going on inside of a rabbit nose. So the purpose of that is to basically increase surface area, right? If we increase surface area, then we have more areas where that can be lined by a protective layer of mucus, right? So when the rabbits are breathing things in, that can trap particles of hay, it can trap dust, it can trap bacteria, prevent things from getting down lower into the respiratory system. And it also helps with thermal regulation. The mucous membranes have a lot of blood supply, a lot of capillaries there. So when the air comes through on a hot day, then those capillaries which contain blood which have heat in them can dissipate that heat, right? It can help with help temperature regulation in those animals. The glands in there also produce a lot of serous or watery type fluid, which on a cold day can help humidify the air so that that dry air isn't making its way to the lungs and irritating the lungs. It can help humidify it. And they also contain olfactory cells. So olfactory cells are what actually do smell, right? And they have 100 million olfactory cells compared to us, which only have 5 million olfactory cells. And I've said this metaphor a lot, but I really like it. If we walked into a house and someone was making stew, we would smell a really nice stew. And if a rabbit came in, they would smell the stew, but they would smell it as the carrot, the potatoes, the peas, the pepper, the beef, right? They would smell it a lot differently than we would, just because they have so many more olfactory cells. Part of the upper airway is also going to include the sinuses. So the sinuses are pockets in the bones of the skull, and they do communicate with the nasal passage through very small little channels, and they too are also lined with mucous membranes. One of the main reasons we have sinuses is because we want to reduce the weight of the skull. If the skull was solid bone, we'd all be walking around like this because our heads would be so heavy, or we'd have really thick neck muscles. So we want to lighten the load of the skull a little bit. It also helps with, because it's lined with mucous membranes, it helps humidify the air, helps with thermal regulation, helps trap dust and debris, and increases the olfactory surface, so another area where those olfactory cells are located. And then the final part of the upper respiratory tract is going to be the pharynx. And the pharynx is basically what we would probably consider our throat, right? If you can get past the nasal passage into the back, then that space between the nasal passage and the opening of the trachea, that's the pharynx. And then we get into the lower respiratory system. So we have the first part is going to be the larynx. So the larynx is basically a complex system of cartilage that's right at the opening of the windpipe or the trachea. Probably the most important part of that, those cartilaginous plates, is going to be the epiglottis. And so I've got this little picture here, and that circle shows where the epiglottis is. So here's the nasal passage with all the turbinates. All the air would come down through here, and it would enter into the beginning part of the trachea. And this little flap up here is the epiglottis. And what's unique in rabbits, or at least compared to humans, is that epiglottis is in front of the soft palate, right? The palate is what separates your mouth from your nose. And the reason that's important is because that ultimately is what blocks air from being able to get from the mouth into the trachea, right? It forms just like this little wall. And you can see that a little bit better on that diagram. So there's the trachea, there's the epiglottis, and then here's the soft palate, right? So it's very hard for air to come in this way, but it's very easy for it to come from the nasal passage and then down the windpipe. And then when the rabbit swallows, that little flap of epiglottis comes down, and then the food can easily get around. That's what makes it challenging to intubate them as a clinician, because trying to get an endotracheal tube from the mouth into the trachea, we've got to watch out for that little flap that basically is trying to block us. The trachea itself is made up of a series of cartilaginous rings, which is important, right? We don't want the windpipe to be something that's flabby, because otherwise every time the rabbits rested their head, that could collapse. So we need some structure there, and that's ultimately what delivers the oxygen all the way down to the lungs. So as the trachea comes down, it divides firstly into left and right, and that's going to get the air down to the lungs. And then they just keep dividing into smaller and smaller tubes called bronchioles, and then they ultimately end up as alveoli. And the alveoli are like little balloons at the end of each bronchiole, right? And that's where ultimately air exchange takes place. When the rabbit breathes in, the air travels all the way down into those alveoli. The oxygen in the air diffuses across the wall, and they get into the capillaries and are picked up by the red blood cells, right, which contain hemoglobin, and that's what delivers the oxygen to the body. All of the waste products of the body, the carbon dioxide, diffuse out of the blood vessel into the alveolus, and then when the rabbit breathes out, out comes the carbon dioxide. So now we're just going to talk a little bit about diseases after talking about the anatomy. So when we look at respiratory disease in rabbits, it can present to us in a few different ways. Sometimes if a rabbit has respiratory disease, it's just very vague. They're just off their food, they're not moving around very much. Sometimes there'll be more overt signs. There may be nasal discharge. So you always want to be watching the cleanliness of your rabbit's nose. But it's also really important to check the front paws, because when rabbits are very clean, and if they start to get discharged, the first thing they're going to do is this. And so I see sometimes a lot of rabbits come in, their noses are clean, but the insides of their front paws are all matted and sticky because they're basically wiping away the snot with their front paws. Sometimes in extreme cases, if they're having difficulty breathing, the nostrils will start to flare. So getting a sense of what your rabbit's nostrils look like when they're healthy is really good, so that you can pick up when something changes. You want to look at their respiratory effort, right? The sides, how is the body moving as they breathe? Sometimes people will hear, like they sound congested, they sound wet. A lot of people will describe it almost like a coffee percolator kind of sound. They might be sneezing, they might be snoring or snorting. The worst prognosis and the most serious diseases are the rabbits that come in open mouth breathing, because now they're desperate for air, right? Maybe the whole upper airway is plugged and they're just trying to get in oxygen any possible way that they can. So hopefully this little video works. And it might not. This might not work either. Sorry, I had some videos of rabbits having some respiratory difficulties. Yeah. Let me try this. Okay, so this rabbit, hopefully you can appreciate how much the body is rocking back and forth, right? The sides are heaving a lot. So that's a rabbit that's struggling a little bit, right, with breathing. And then the other video, this one's the more serious one. That's open mouth breathing in a rabbit, like and the nostrils are flaring, and the whole body is just heaving, right? Like that poor little rabbit. Unfortunately, that rabbit didn't make it. It was so severe that we ended up putting it down. Okay, so now we're going to look at some of the reasons why respiratory disease occur. So sometimes there can be a primary respiratory disease. And what that means is there's a disease process that's affecting some part of the respiratory system, whether that's the nose, the trachea, the lungs. Something has gone wrong within the system itself, and that's why the animals are showing signs of respiratory disease. Sometimes you can have something that's going on outside the respiratory system, but it looks like a respiratory problem, right? And that's when you get into things like heart disease or anemia. You can have those diseases that aren't diseases of the respiratory system itself, but they look like they've got similar symptoms. So when we look at primary diseases of the upper respiratory tract, they're certainly concerned for allergies and irritants. I can't say that there's any hard science to back that up. I mean, it's hard to study allergies in rabbits. But I've certainly assumed it based on histories. I've known people where rabbits start sneezing or they have discharge, and then you find out that maybe they've changed detergents, right? Or they have something that's heavily scented in the home. So it makes sense to me that there would be something that would cause sort of an allergic reaction to them. So you always want to make sure that you're checking for air quality, you're looking for sources like air fresheners, incense, scented candles, right? Anything like that that might potentially be an irritant to that upper airway. In order to sort of help with that, you could certainly try things like air purifiers, humidifiers help a lot. I've had some people think that their rabbits were allergic to certain kinds of hay. So trying to shake the hay to get the dust down, or even misting the hay to trap some of that dust really helps, and removing anything that's heavily perfumed. Upper airways can also be affected by infections. So bacterial infections, very common in rabbits, and you'll get basically infections of the nasal passages, the sinuses. That you can have infection of the duct that runs from the eye to the nose. And unfortunately, everything in the head is connected: eyes, ears, nose, throat. So it's very easy for something that starts off in the nose to travel to other parts of the body, especially the ears. So again, this is just a little diagram of the nasolacrimal duct that runs from the eye to the nose. We've got it too. It's why your nose runs when you cry, right? But it's a nice little pocket. It doesn't have very good airflow. It's moist. It's warm. It's a nice little area for things to start growing. And oftentimes they'll present with eye discharge as well, because as soon as that duct plugs up, the tears have nowhere to go, so they start to spill out over the sides of the face. There are oodles of different kinds of bacteria that can cause upper respiratory tract. Everybody wants to blame Pasteurella, and it's certainly one of the big culprits, but we also culture a lot of other things when we are investigating this disease. And it's very rare that we find a rabbit that has just one, right? It's very often the case where they have multiple bacteria growing in there. And so sometimes it's a few different things that are contributing to the upper airway problem. Another reason that they can develop diseases of the upper airways is going to be foreign bodies. Rabbits are constantly sniffing. So it's very easy for a sliver of hay to get up there. If it does happen, oftentimes it's only one nostril that's affected. It's very unusual for them to inhale both sides. So sometimes the rabbits will come in and the discharge is all on one side. So that's an easy way of kind of, it gives you an idea that maybe it's a foreign body that's in there. And they'll sneeze and they'll have lots of discharge, and sometimes they're pawing at their nose, because it's clearly irritating to them. Respiratory disease can sometimes, again, not be a primary issue, it can be a secondary issue. So dental disease can often be correlated with respiratory problems. So you can actually get teeth that overgrow, and they'll actually start to grow into the sinuses, into the nasal passage, and then that can cause all kinds of problems. So what are some of the things that we do to sort of figure out what's going on? Well, one of the first things we often do is a culture, right? So we take a very small sterile swab and we go up the nostrils. And then that gets sent off to the lab so they can plate it out and figure out what bacteria is growing there. And the nice thing about it, once they've isolated the bacteria, they can then grow things in the presence of antibiotics. So each of these little discs has antibiotic in it. And you can see that, this one that contains this antibiotic has no growth of bacteria. So that would be a good antibiotic to use, right? As opposed to this one where the bacteria are crawling all over it. right? So they give you sensitivities so to help guide your therapy. Another thing we'll do is a nasolacrimal flush. So that usually involves putting a little freezing on the eye, and we'll take some sterile saline, a little plastic tube, and we insert it into the beginning or top part of the nasolacrimal flush, and duct, and then flush it all the way through. And we can actually collect the material that comes out the nose. We usually ask someone who wants to be booger catcher today because sometimes the rabbits will start sneezing, but we got to get it. And then that can get sent off for a culture. The nice thing about this too is it also acts as a treatment because it'll flush out some of the material in the nostrils, it'll flush out the material in the nasolacrimal ducts. We can also do things like x-rays of the skull. So x-rays don't interact very well with air, right? And the nostrils are mostly full of air. And that's why on this side, you just see a lot of blackness. And that's because there's nothing really going on in that nasal passage. But if you have chronic infection or inflammation, there's stuff in the nostrils. And that's what the x-rays will sort of pick up. And you'll see sort of this diffuse hazy whiteness, which means that there's probably infection or inflammation in there. Probably the gold standard is CT scan. CT scans are really good at soft tissue. They're really good at looking at spaces, which x-rays aren't so great at. And if I win the lottery one day, maybe we'll get one. But this is sort of a normal rabbit. So we're basically looking at a slice this way through the face. But you're seeing all these little turbinates and these nice empty spaces. But once you start getting infection and inflammation, the walls of the turbinates get thicker. They actually get material building up on them, in them. So all of that stuff can be just a source of infection or irritation for the rabbit. Another way to sort of evaluate the nasal passage is endoscopy. So you actually can stick a scope up there and have a look around. And this is what you're seeing in a normal rabbit. Just again, all these turbinates. The scope is going up one of the meatuses or one of the spaces. And you're looking for things like pus or abscesses in there. Like all of those little spaces get full of infection. Or even a foreign body, right? So you can see this. Hopefully you can see it, but there's a piece of hay all caught up around the turbinates. So what do we do in these cases? Well, we always try to do medical management first, right? So based on our culture and sensitivity findings, we'll start them on antibiotics. We might want to start them on anti-inflammatories if there's a lot of inflammation in the nasal passage or in the sinuses. Mucolytics, so if there's a lot of mucus in there, we can give medications to break that up. Sometimes we're doing that orally, sometimes we're doing that through drops. This is one method we use quite often, which is nebulizing. So if you have ever seen kids with asthma and they have a little machine that has a hose, and the kids put the mask up to their face and they breathe in the medication, well, you could use that same machine, take the mask off, take the hose and plug it into basically a clear container, and your little rabbit can sit in there breathing in the medications. In extreme cases, sometimes surgical intervention is needed. Those turbinates trap a lot of stuff, right? And it's really hard for medications to get in there and clear it all out, which is why I think, so many rabbits have chronic upper respiratory problems, right? And so sometimes you have to get aggressive, go through the bone, go in there and actually scoop material out of there. It's very unusual that we get to that point, but sometimes it is necessary. Then we're going to talk a little bit about diseases that now are affecting the lower respiratory system. So pneumonia, again, a very common reason that they'll come in with respiratory problems. And this is just infection or inflammation of the lung tissue. It can be due to bacteria. Again, Pasteurella is a big culprit, but many other bacteria can do it as well. Fungal infections have been reported. I've not seen it. Calgary's pretty dry, so we don't get as many fungal problems here as they do in other places. But in general, fungus, if you've got an animal with a fungus infection, that's a big red flag, something's not right. Like usually they're immunosuppressed, right? Or there's a really, really dirty environment because fungus is not typical for them to get. And then you can get viral problems of the lungs as well. Sometimes pneumonia can develop if they've aspirated something. I know some rabbits are just notorious for just hoovering up pellets, and I have had calls from people where, unfortunately the rabbits hoovered it up so fast, they literally inhaled a pellet. And then what will happen is that like any kind of food debris will come in and they'll settle down, usually in the front part of the lungs, like it's just going to go down the first tube it hits, and then it's foreign material, they're growing stuff, and you'll see a section of the lung that's really dense because of the infection that's building up in that spot. You can also have cancers that develop in the lung, and that cancer, it can be primary, meaning it'll actually be lung tissue that becomes cancerous, or more often in rabbits, it's metastatic. And I will say this is very common to see in rabbits, female rabbits that are not spayed, right? They often develop cancer, about 80% of them will develop cancer, and it tends to be a type of cancer that spreads, and one of the places it likes to spread to is the lungs, because the lungs have a heavy blood supply. So any cancer cells are traveling through, and they just set up camp, and you get all of these little tiny dots, or it's a metastatic cancer that's growing in that rabbit. Pneumothorax, we don't see this very often, but it's also a possible cause for lower respiratory tract disease, and this is also known as a collapsed lung. And that can happen for one of two reasons. Either there can be damage to the lung tissue itself, maybe it's a cancer, maybe it's an abscess, and it's caused damage inside the lung so that now air that's being breathed in is leaking outside of the lung, and it's getting trapped between the lung and the chest wall. Right? And as the rabbit breathes, more and more air is getting pumped out into that space, and that puts pressure on the lungs. I mean, the lungs are spongy, they're just full of air, so they're going to collapse pretty easily. But you can also have an open pneumothorax, which means that maybe there's been trauma, a dog bite, right? A tooth has gone through the chest wall, and now air is coming from the outside of the body into that space between the lung and the chest wall. And this is what it would look like radiographically. Right, so this is a normal rabbit, there's the heart, this is lung tissue, and then here's the heart. This lung looks dense because it's now all compressed, and this would be all air up in there. You can also get fluid that builds up between the lungs and the chest wall, and that can happen for a few reasons: heart failure, cancer, trauma, pneumonia. So how are we going to sort of diagnose lower respiratory tract problems? Well, the first thing we're going to do is listen, right? When we listen, we're listening for wheezes, we're listening for crackles and any kind of abnormal sound. We want to be able to pick that up. Is it on this side? Is it on that side? Kind of give us an idea of where things are going wrong. We can do things like blood work. Sometimes if there's infection, you may see an immune response, right? The white blood cells will go up a lot. X-rays are generally my test of choice. I like to start with those to see what's going on in the lung. I mean, you don't have to be a vet to know that the one on the right is clearly abnormal, right? This is, again, the lungs are made up of air, so X-rays tend to pass through them pretty nicely. As soon as you've got stuff in there, it acts a little differently, and you'll get this whiteout. You'll also see on this one, compared to this one, the trachea on this one comes in nice and straight, and the trachea on this one gets pushed quite up quite a bit, which means something is down here. Either the heart has gotten big or there's a tumor, but it just displaces things. Other things we can do is cytology. If you do x-rays and it looks like the lungs are floating in fluid, there's no reason why you can't sedate or anesthetize and pass a small needle into that space and try to draw up that fluid, figure out what it is. Is it blood? Is it infection? Are the cancer cells in there? Gives you an idea of what needs to be done. Sometimes a biopsy has to be performed. So when we look at these three lungs, when I look at them, they all have little dots all through them, right? But they could be any number of things. So it could be a fungus, it could be cancer, it could be a bacterial infection. So sometimes you actually need a piece of that tissue to figure out what it is you're dealing with. And if we're dealing with infection, again, we've got the option of nebulizing, so having the rabbits breathe in medication. We've got oral antibiotics. And if you're not medicating like that, then you're just doing something wrong. Your rabbit should just be running right up to you and just taking it off the syringe. Thoracocentesis, so again, sticking that needle in, not only to get your diagnosis, but to get some of that fluid out of there, right? If they can't breathe, draining some of that fluid gives them a little bit more space so that they can actually get some air in there. In some cases, if we're dealing with cancers, maybe we're having to do chemotherapy. I have referred a few rabbits to some of the larger vet clinics in the city for chemotherapy for lung cancer. Surgery as well, not with me. I'm not a board certified surgeon. There's a certain limit of what I can do, but there are board certified surgeons who are more comfortable opening the chest. But then again, you get to that whole group of diseases that we talked about that look like respiratory problems but aren't actually respiratory problems. So one of them is going to be anemia. And anemia is just when the red blood cells get low. Red blood cells are what ultimately grab the oxygen from the lungs and take it to the body. So if there's not as many of them, then the body is losing oxygen, and so it starts to breathe heavy. Those animals start to breathe harder and faster because they're trying to make up for that loss of red blood cells, getting as much oxygen in there. So basically, that can happen for a variety of reasons. Toxicity can cause anemia. Onion toxicity, we see it a few times. If any animal eats a lot of onion, it actually causes red blood cell to burst. So you want to watch what they're eating. Cancers can do it. So if they have leukemia and the bone marrow is being replaced by cancerous cells, they're not making as many red blood cells. So again, that can cause anemia. If there's bleeding, if there's kidney problems, liver low portion, there's a whole bunch of reasons why that anemia can happen. And what we'll tend to do is try to do a blood transfusion in extreme cases. Sometimes if it's mild, we may want to do just some iron to help them build up their red blood cells. But you got to treat the cause, right? If there's bleeding, you have to stop it. If there's a liver low torsion, you got to go in there and surgically remove it. Heart disease can also present as respiratory problems, and that's because when the heart is pumping, it's always pumping blood forward. If it doesn't do that as well, then the blood backs up. And the blood vessels are not super strong, they're leaky. If you increase the pressure, more stuff is going to leak out of those blood vessels. And that's what happens within the lung tissue. So you do get a lot of fluid building up in the lungs. Another sign of heart disease is going to be bilateral bulging eyes. So they may be respiratory, but they'll also have their eyes bulging. And the reason for that is, again, because the heart's not pumping the blood forward, it's backing up, and there's a large blood sinus behind the eyes. If that pressure builds up because the blood's not going forward, the eyes get pushed out. And so you'll see it bilaterally on these guys. So we'll do things like chest x-rays, right? It's pretty easy to see how massive that heart is. It's pushing the trachea right up against the spine just about. We can do things like echocardiography, ECGs, so it's ultrasounds, testing the electrical conductivity of the heart. And again, your rabbit will magically come over and willingly take the medication off that syringe. And the idea of medications is that we're trying to reduce the workload of the heart, right? We might give a diuretic so they urinate more. We might give something to help the contractility of the heart. But, and then our rabbits are so well trained that they just come on over. And I had to laugh at this picture because we all know it's like this, right? There's two people, they're fighting. Why is this rabbit not taking the medicine? I don't know. Are you holding it right? I don't know. Can you lift the lip? I told you to lift the lip. Do you want to do this? I don't want to do this, right? And that's usually the way it goes. And sometimes I wonder how many divorces happen because they had to medicate the rabbit. How can something so small be so strong? I don't know. Okay. This is actually a very common thing that we see at our clinic that often presents as respiratory problems but isn't truly a respiratory disease. And this is a thymoma. And a thymoma is basically cancer of the thymus gland. And the thymus gland sits just in front of the heart. And you gotta remember, the chest is a box, right? Like there's not a lot of room for things to expand. So if something starts growing on there, that lung is going to compress pretty quickly. And so with the thymoma, up until recently, it was palliative care, right? It was, I would, tell people maybe surgery. not with me. We don't have the things needed to do it, crack open a chest, but maybe a board certified surgeon can help you. But recently there was a paper that was brought out that showed how well steroids actually control this disease. And we have a few rabbits that are on steroids where I'm blown away by how much it has increased their life expectancy and improved their quality of life, because I was a staunch no steroids for rabbits kind of person until this paper came out. So there is a place for steroids in rabbits, and it's been a lifesaver for a lot of animals. Okay, any questions about respiratory disease before we start talking about rabbit hemorrhagic disease? Yeah.
Why did you say usually no steroids for rabbits?
So rabbits are actually giving rabbits steroids is the animal model for studying liver abscesses in humans. If you give a rabbit steroids, it can produce liver abscesses because it immunosuppresses them so much that they get infections in the liver. So in general, you wouldn't even give a topical steroid on an eye to a rabbit. They can be so sensitive to it, right? But in a case where you have life-ending cancer, you pick your battles, right? And so you're always watching out for signs of infection, but that's why generally we don't tend to use steroids in rabbits. Yeah. Any other? All right, so I decided to do this because obviously it's just gone really south for the poor rabbits in our city. So we're going to do just talk just a little bit about some basics about rabbit hemorrhagic disease. So rabbit hemorrhagic disease, the family of viruses that this disease is in is called Caliciviridae. And the reason it's called that is calici is actually Latin for calyx, which means chalice or cup. And if you look at the virus under microscope, it has these little cup-like depressions on the surface. So that's how it got its name. So caliciviruses, there are actually a few different subtypes, right? So we go from a family down to the genus. So there's a few different genuses within the calicivirus family. The one that a lot of us are probably very aware of is norovirus. It causes Norwalk disease, right? That causes quite severe vomiting, diarrhea in people, especially in the wintertime. People are very aware of it, especially in like old folks' homes and stuff. So you sort of want to be careful of that one. Vesivirus, so this is a common cause of respiratory disease in cats. And it causes a lot of vesicular diseases in a lot of different mammals. So these are like blister-like diseases, anywhere from sea lions to pigs to whales to walruses, primates, humans. So that's another really bad virus. And then it's the Lagovirus that we're mostly worried about. And that's the one that ultimately causes the rabbit hemorrhagic disease. And within the Lagovirus family, there's a few different kinds. There are benign forms of Lagovirus, right? Now, they're not really well understood because they're benign, right? Like viruses don't have the intention of causing disease. They just want to reproduce, right? So if they can go into a rabbit, reproduce, and be excreted, and not cause any fuss, well, they're generally not something that people really care about because they're benign. There is another one that's a little bit it's on probably the radar of a lot of people in Europe. It's European brown hare syndrome, and it only affects European brown hares and mountain hares. It's been around for a few decades, and it's quite a nasty one too. It's very high mortality rate, and we're all hoping it stays in its lane and it doesn't really transmit to any other kinds of rabbits. And then you have the rabbit hemorrhagic disease virus. So the rabbit hemorrhagic disease virus, the first sort of reported cases were in 1984 in China. There was a group of Angora rabbits that came in from Germany. That was thought to be the very initial infection. And it kind of makes sense, right? You have rabbits that are very stressed, right, in that transport, and they're Angoras, so you've got to be able to code. So, that when you have a stressed animal, sometimes that's where mutations and stuff can start to happen. It was highly contagious and highly deadly, unfortunately, and it spread quite quickly across China. And then in 1996, a new sort of subvariant developed, and it seemed to be very similar to RHD1. It was only affecting the European rabbits. It was only affecting adults, so it was still staying in its own lane. And it wasn't really until 2010 that something happened, and that some sort of variant occurred in France. And now it was starting to get outside of its lane. It was starting to affect wild rabbits, and now it's starting to affect hares, and jackrabbits and cottontails. So it wasn't just affecting the European rabbits anymore, and it wasn't just affecting adults. Now it was starting to affect the young rabbits as well. And again, very highly contagious and fatal disease. And I mean, when this all started happening, I had a lot of requests from places asking for interviews about the disease. And one reporter asked me, "Well, do you think it's man-made?" I'm like, "Oh my God, no conspiracy. It's all good." Because really, it probably was maybe ultimately it originated as a mutation of the benign form, right? There's two leading theories. One is the benign form mutated, and then that ultimately caused this aggressive pathogen, or a virus, another Legovirus that wasn't in its lane, crossed over right into rabbits. If you have a virus that transmits from one species to another, that tends to go really badly. So it's possible that maybe it came from another species. But I think right now the main theory is that it was a benign one that mutated. So this disease obviously is nasty. I'm sure we've all heard about the symptoms. Most rabbits just die, right? They get the virus and they're fine, and then they're dead within a couple of days. Some of them develop neurological signs. They'll start to walk like they're drunk. They start to seizure. They'll have difficulty breathing because bleeding starts to happen in the lungs, and sometimes they're bleeding out of every orifice, and it's just a horrifying disease. It's transmitted one of two ways: direct contact from rabbit to rabbit, respiratory secretions, saliva, fluids from the eyes, blood, or it's transmitted indirectly. Right, you can have something that's contaminated, whether that's a food or water dish. You can have, unfortunately, predators or scavengers accidentally transmitting the virus, right? If they go and they scavenge on an infected carcass and they pick up blood or something on their hands or their claws, and then they go somewhere else, they can transmit the virus that way. Or if they pick up an infected rabbit and carry it somewhere else to devour it, they've transmitted the virus. So it can spread quite easily. How are we going to prevent this? Well, ideally vaccination. The vaccine, I've had a few people asking me about the efficacy. The Filovac vaccine, when we contacted them, they said that their vaccine is 90% effective. Right, that's really good. It's not 100%, which is why people still need to take precautions, but it's 90% effective. We want to clean and disinfect everything, and it's important to remember that you can't disinfect something that's dirty. So if you do walk through a field and you get contaminated droppings, urine on your shoes, you can't just spray the shoes with Burcon, right, and expect that to work. Ideally, you want to kind of wash them a bit and then disinfect, which is why sometimes it's not a bad idea to have just outdoor shoes, right, that you're not maybe bringing into the house. There are a few disinfectants that work well. So if you have household bleach and you dilute it 10 times with water, that works well. Of course, that's hard to do. Nobody wants to pour bleach on their carpets. So that gets to be challenging. Vercon is another one. Some of the accelerated hydrogen peroxide cleaners work really well, or they do work well. I've had some people ask me about Lysol, and I mean there are lists that say it doesn't work, there are lists that say it does work. I think that you're going to be very careful with Lysol just because it doesn't seem to be quite so clear-cut about it. Any new additions should always be quarantined, separate airspace, right? In fact, when we have clients call and they have a new rabbit that it's when they caught from outside, like we're telling people, well, you can't come into the clinic for at least 2 weeks, right? That's going to be your quarantine, because we don't want, if they caught something outside and they picked up the virus, we don't want to bring it into the clinic. Avoid hot spots. right? Seaton, the Manchester industrial area, Skyview, I think I've heard, right there, all those pockets where those lots of stray rabbits are going to be potentially contaminated with that virus. And just keep the outside out. Right now, I'm not bringing in any grasses from outside. This year, I'm not going to bring in a lot of things from the garden to my rabbits. And the sad thing is that virus can survive for months in the environment, especially in organic material. So one of the recommendations right now is, people who are getting hay locally, that hay maybe be stored for a minimum of 3 to 4 months before you bring it in the hopes that virus will dissipate. This is the map that I found. This is from 9 days ago. This is published by the United States Department of Agriculture, and it's a map showing cases of domestic rabbits. So these are European rabbits, right, or pet rabbits, and then cases of wild rabbits. And the light tan is just domestic rabbits, so these are pet rabbits. The dark brown is domestic rabbits and the wild rabbits. So jackrabbits, cottontails, hares, pikas. And anybody knows where it's right there, right? It's not stopping there. And I just found out yesterday that there was a mountain cottontail rabbit that did test positive. They found the carcass that did test positive for the virus. So it is in the wild animal population in Calgary. And so we just have to use caution, even being around the wild rabbits right now, which is, again, heartbreaking. I have jackrabbits that come to my yard, and takes everything to not just want to be able to scoop them up and take them in, but we just have to use a lot of precautions so that we're not endangering our pets. So that's all sad and depressing. So is there any good news in all of this? Well, more testing is being done, right? I mean, oh my God, we're all amateur epidemiologists after the past 2 years. So we all understand the importance of testing for a disease. And the university is doing a great job of testing domestic rabbits and wild rabbits. Again, we're at the beginning of things, and so it's getting to be a little confusing about who you call, because we were told, people can call Fish and Wildlife, but then they're calling us saying, no, we're telling people to call you. It's like, wait, what? So yeah, right now, just again, we just want to be able, the testing's being done, bodies are being submitted, and so we just want to make sure that we know where that virus is, so we know where to avoid. And then the most important thing is the vaccine is now available to all clinics. It has been challenging the past 4 years for a clinic to try and get the vaccine into the country. It's a lot of paperwork, it's a lot of going back and forth to Border Patrol and our airport, and but now there's a Canadian distributor that's bringing it in. I actually had a veterinary clinic call me yesterday because it's the first time they brought in the vaccine. They were able to do it through the distributor, and they wanted to know what our experience was, and what side effects we were seeing, and how we were doing it, and all the things. So it's fantastic, because that means more animals can get vaccinated, and that's really going to be key to keeping them safe. All right, so that's all the news I have. Yes.
Is there any way, like the cold winter weather coming, does that?
No, that this virus survives heat, it survives cold. It's a non-envelope virus, and I'm not a virologist, but the basics I remember from vet school is the viruses either have an envelope or they don't have an envelope. If you have an envelope, you're wimpy, right? I think of it as a person who's got a big winter jacket on. You take out the winter jacket, right? It's like no good. But if you're a real tough Canadian, you go out in the cold, right? You don't have a jacket, then you're tough, right? And that's what these ones are. And cold, heat, that's why the very limited number of disinfectants work. They survive for months. They transmit through the air, right? Like it's so yeah. No, unfortunately, which is why I think they really hoped it was going to go away in BC when it first came out. They really hoped that the winter was going to nix it, and of course it didn't, just like it didn't anywhere else in the world. Yeah.
I just have one more question.
Sure.
Is Do you think that Fish and Wildlife would vaccinate is there any way to do the Harrison jackrabbits?
I don't think they will. No, I don't think anybody really has done that. And that's why it probably has taken, it's only until yesterday that we found out in that one wild rabbit, and it's hard to do wildlife stuff, right? Because, you know, a lot of these animals are in the middle of nowhere, where no one's gonna see them. You know, by the time they die, a coyote gets them, there's a lot of ways, the cards are stacked against them for testing, so good on them for finding that one rabbit. But to vaccinate is probably logistically impossible, yeah.
So just a question with the migration of birds at this time of year. So the poultry, you see more increase of avian flu, and they're monitoring that, right? Is migration of the wild birds causing an issue at this time of year?
Yeah, that's a good question. I'm not sure anybody's correlated that with migration of birds, because it's going to be, I guess birds of prey, right, that would be doing it. I'm not sure if that's how it kind of went off in the States, because you would think it would have more of a north-south distribution as opposed to east-west, right? So I'm not sure if that is, it may be influencing it, but not to such a degree that it's making a big difference that way, yeah.
What's the future of it then for, say, the wild rabbits,
Yeah.
vaccinations? Does a virus eventually run its course and they
That's
get
the hope,
antibiotics,
yeah.
or-
And I will say, I can't say I've heard a whole lot about what's happened to that group of rabbits in BC where it all started, right? I don't think they've really come back, those big stray populations. I'm not sure what's happening because this is so new, right? I don't know what's happening with all of the wild rabbits in the States, because really this all started in the States probably in 2020, 2021 with all of the wild rabbits now kind of like the domestic rabbits were getting it first and the wild rabbits were lagging behind. So I'm not sure if those populations are coming back. I think that's something we'll know within the next 4, 5, 6 years, right? I hope so, right? And the thing about the virus is not all of the animals die, right? Mortality can be 90%, which means 10% are living, right? You know, is there something special about their genetics that maybe they will pass on to the next generation? Fingers crossed, right? It's certainly in a country like Australia, where they release it on purpose to get rid of strays, they still have to mutate the virus every few years and send it out the door again because there are rabbits who are resistant, right? And those are going to be the ones that will probably save some of the species. But it's hard when you have some species, like there's a brush rabbit in California that's already endangered and they're finding it in carcasses. Like, is that going to wipe out the species? Like, will they have time to recover? I don't know. Yes.
How far north of Kelvin is it being found?
That's a good question. I heard that there was suspicion of airdrie, although I heard today that maybe it wasn't confirmed. For sure in Edmonton, right? So Edmonton had that outbreak. There was a population in a cemetery. They had stray rabbits in a cemetery up in Edmonton. This was like this past Christmas, and they had like 50 dead rabbits. So for sure there. How much farther past Edmonton, I don't know. Because it all depends on where the stray rabbits are. Really, the stray rabbits, the big populations are probably going to be in the bigger cities, right? There's probably not big stray rabbit populations in like fields in northern Alberta, right? Unfortunately, people dump them in the city. And so, yeah, Edmonton for sure. But it's interesting, that group of rabbits actually had rabbit syphilis, right? So they were already kind of diseased, right? So it's probably just one last thing that took them out, right? But for sure, Edmonton. I'm worried. I'm waiting for Canmore, right? I mean, let's face it. Canmore is right for that potential spread. Yeah.
What about isopropyl alcohol as a disinfectant?
Yeah. Yeah, that's a good question. That it's not ringing a bell for me that's been on the list of ones that work or that they're recommending. It tends to be Vercon, the accelerated hydrogen peroxide, and the bleach is what everybody's recommending.
I just have a small child, so I can't.
Oh yeah, no, yeah, fair enough. Yeah. I mean, what I would do is, if you can use something of Vercon or something, and then rinse it really well. Like you wait, the contact time it has to be 10 minutes. Right? It's another thing. It's a tough bug. So now not only do you have to clean it with Vercon, you let it soak for 10 minutes. And then rinse it off really afterwards, yeah. But again, having outside shoes and clothes, versus inside, right? That's another way of keeping things safe, yeah.
So if you've got greens in your back garden that you give to your rabbits, and you were saying like you don't do that anymore.
Not right now,
Yeah.
not right now. You don't wanna do it in the middle of the blowout,
Okay.
yeah.
Would it be okay if you put the greens in like a UV cleaner though? Because I've got like a UV
Yeah.
system. You wax in that.
That's a good question. I'm not sure the effectiveness on UV. I'd have to look into that. I can find out and let you know. But, I'm not sure. Yeah. Anything else? Yeah. It's been heartbreaking. We've been getting calls from people who are seeing animals dying out and, in populations where, I was in Seton a few months ago and every meridian had a dozen rabbits on it, right? And now they're just gone. And it's been hard, and it's been hard telling people it's got to run its course, right? And isn't that awful? That it just has to run, and you feel helpless, and you feel, but there is hope. Like I said, the vaccine is now there, and it wasn't, just a few months ago. And so, it's a light at the end of the tunnel. And being aware and knowing where the virus is and knowing what to do, I think it's going to go a long way to protecting everybody. Anything else? Thanks so much, everybody, for supporting Against All Odds. It's really just a hard-working group of people, and they deserve all of the support you guys can give them. And so, thanks for showing up.